I think actually we're just beginning to really understand all the opportunities that neoadjuvant endocrine therapy holds for us. So there is actually a national clinical trial ongoing right now called the Alternate study, which is kind of the successor to the Z1031 study. And what that study is doing is taking patients with estrogen receptor positive disease and treating them with endocrine therapy. And one of the really neat aspects of this study is they do a biopsy of the tumor several weeks into treatment. And if that biopsy shows that the tumor has really kind of stopped dividing and growing, and they look at the proliferation rates, if the proliferation rate is down, then they continue on the endocrine therapy. And if the proliferation rate has not shut down by the treatment that they're on, then those patients are recommended to go on to chemotherapy before surgery. And so really I think one of the exciting things is to take these patients and work out if this tumor really, really responds very well to endocrine therapy, then maybe these patients don't need chemotherapy. And if these patients don't respond well to endocrine therapy, then they probably would benefit from chemotherapy. And I think from the patient standpoint, that's very exciting because they could potentially avoid chemotherapy. But it's also important to give chemotherapy to those patients that really do get the benefit from it. And so I think that that's a great opportunity. What we've seen, some of the data that Dr. Ellis has shown is that if a patient receives endocrine therapy and then they get to the operating room, and there's very little volume of disease left and it's not very proliferative, so the Ki-67 is really shut down, there's a score called the PEPI score. And if the PEPI score is 0, those patients have a very low risk of relapse. And so potentially those patients can completely avoid chemotherapy, which is excellent.
Great.